Hello, welcome to Portage County Matters. My name is Patty Dreier. I'm Portage County Executive, and I'm really glad that you joined us today. My guest today is Janet Zander, the Director of our Aging and Disability Resource Center here in Portage County. And as usual, I want to start off with a little bit of news, and then we'll get right to Janet. So anyway, the big news is that our new Emergency Management Director has been appointed, and we're working through the county board for his confirmation. His name is Keith Krieger, and he has grown up in Marathon County on a dairy farm in Athens in particular. He has gone into the military in his life. He spent about 20 years on active duty in the U.S. Army. He had 3 combat tours and served as a crisis team leader for U.S. NORTHCOM. That's the United States Northern Command, and that protects our whole homeland, America's homeland, its people, its national power, and its freedom of action. I thought that was a very interesting reference to U.S. NORTHCOM. Following Keith's military career, he also has continued to pursue his second career as an emergency management director. He is studying for a PhD in the field. He'll complete his doctorate this year. Keith has a diverse educational background. It's really interesting. Some education at UW River Falls for 2 bachelor's degrees in agriculture as well as political science, and then went on for a master's of science and administration from Central Michigan. So he's really looking forward to coming home, to taking his emergency management and crisis team leadership here to a local jurisdiction, and we're really excited to have him. You'll hear more about his planning experiences with FEMA, the fact that he was an EMT, and so on and so forth in the coming days as you read about it in the newspaper. In mid-April, I was asked, this is a normal process in county government, I was asked to make my recommendations on the capital plan for our county. And the capital projects plan is a plan for projects that are $25,000 or more. And what we do is we have a process where the county executive leads it off, and then I present these recommendations to our county board. The projects had all been submitted by the departments of the county government, and then after I make my recommendations, it basically sets a ball in motion so that there can be deliberation and research and conversation around whether or not these are the final recommendations that our county wants to settle on. And we're on our way to a county board in July when they take up the entire plan that will have been deliberated on between now and then. The board then will vote on it, and barring any veto from the county executive, then it becomes part of the budget planning process for the following year and years to come. There are no appropriations with a capital plan yet, so it's about laying a conceptual framework for a plan. And we're talking about projects then like roads and buildings and other major initiatives, such as public safety communications is a major initiative in the particular plan that I forwarded to that committee. And you should know, as I kind of lay the groundwork for this capital planning process, that you should know that Portage County has positioned itself to be debt-free every 3 to 5 years. And so we currently have no debt that is scheduled out to exceed 5 years for Portage County government. So what did I submit in my recommendations last Thursday morning before the taping of the show? I submitted a response to numbers of projects that had been submitted for the healthcare center physical improvements to the building. And instead of continuing to try to reconfigure our existing healthcare center on Whiting Avenue that has been in that current location since 1931, instead of continuing to try to reconfigure this building so that we can have private bathrooms and single rooms for baby boomers that want those kinds of facilities in order to meet their needs during their lives and their use of the healthcare center. I'm proposing that sometime in the future that we look at a new healthcare center design, a new healthcare center facility that can better meet the needs of the people using the home for shorter-term rehabilitative or longer-term end-of-life care, as well as those working in the home. That I think a new building instead of building another wing onto our existing facility, for example. I think a new building will help us improve our business model, and again, will improve operational efficiencies and help meet the needs of the people using the home. And the current healthcare center building I propose could be repurposed. So there will be a lot of discussion on this happening in the community. As you are going through the next weeks and months, I hope that you will take an opportunity to connect with your own county board supervisors and other committee members and my office to help us gather your ideas about this idea of a new healthcare center building in Portage County's future. Another major project that I did want to mention during the show today, and then we'll get on to a couple other news bits before my guest, is the idea that I proposed in response to the discussion that I hear everywhere in county government meetings related to the need for a jail. I propose that we look at it a little more broadly, that we look at a facility. I'm just calling it a community corrections center, though I believe the name would have to be different than that, and it's only for a concept and design of this facility. It doesn't mean that construction happens tomorrow. Just like the healthcare center, this would be sometime in the future to pave a pathway so that we would know when we were going to replace our obsolete jail and our jail that has limited capacity that doesn't keep up with the times that we're in right now. So anyway, this community corrections center is a design for a facility that integrates a continuum of services and it addresses a number of needs. It has a secure detention kind of area in the vision I have, but it also includes consideration for the fact that we have a number of Huber inmates, so they get released on a daily basis to go to work, and perhaps we don't need to staff so intensively for people who have a work release in their orders compared to someone in a violent offender in the most secure area of detention. We also have a day report center where lots of people receive drug testing as part of their probation and parole. We have a Portage House in Portage County. We have a juvenile detention center. And I think that we need to look much more broadly at the entire justice picture, the entire corrections picture, in making decisions about the future of a jail facility for Portage County. You can count on this one having a lot of deliberation and a lot of discussion, and I really hope that you're going to get involved with it. Our current jail is 22 years old this month, the month of this viewing of this show. It has a capacity of 79, and we can only fill it to 85% because of the need to classify prisoners, that is to assess their risk levels and then separate them from each other in appropriate ways to keep both the offenders and the staff safe. We have issues with some safety and blind spots in the jail and some other facility needs, as well as, you know, the fact that it is an obsolete design and it isn't a very efficient layout for a jail facility to help us contain the operational costs that it takes to run it. So again, whether to ship prisoners to Lincoln County or not in our future is something that I think we'll need some extra homework and deliberation on. We normally ship about 35 inmates to Lincoln County, so we've got decisions to make as a community. Again, this is your chance to get involved in shaping that future. Now, a couple other points I wanted to share with you. One is about unified dispatch. Right now, it's getting closer and closer. It's looking like it will be actually August 4th by the time we integrate the city dispatch with the county dispatch operation. So I applaud the efforts of the Chief Deputy Contos, as well as a number of other individuals who are working really hard to help us move through all of the different steps that need to happen before we can do this appropriately for the staff and safely for our community all the way around. Strategic planning, you've heard me speak about this numbers of times. The draft window is about to close, so you've got till May 15th to provide input to my office. We have been hearing from a number of you, I really appreciate that, with really excellent ideas and thoughts and real true consideration about the details of that plan and what it means to them and where they would like our county to go. So I hope that you will make time for that in your life. You can find a copy of the draft at our county website. as well as an opportunity to come and share in person, write a letter, write an email. The other thing that you can do is show up to one of the 2 remaining listening sessions in this cycle of listening sessions to have a conversation with me directly about it. One is scheduled for May 9th, Thursday, Pine Grove, 6 p.m. at the Pine Grove Hall. Any citizen from anywhere in the county can come. It isn't just for Pine Grove citizens. And also Monday, May 13th, in the Town and Village of Almond at 6 p.m. at the Village Municipal Building. So again, I hope that you will consider coming. I'd love to see you there. The last piece I wanted to offer was related to technology in the county, enterprise resource planning. Now, you've heard me talk about ERP in the past, and working with a consultant here in Portage County, as you know, that we've been studying since late last year, the current financial and human resource and payroll systems that we use in county government. And this is all part of a needs assessment that we're pulling together so that we can write a request for proposals, put out bids, and go about selecting a vendor who can help us next year in 2014 begin to roll out the next generation of these technology systems for county government. I want to share with you a visual. I know that we have a different approach here in Portage County, and I'm going to show you a picture of the bubble charts that have arisen through the needs assessment. I think this is important. Even you'll get a broad look at it just from a distance about what does it look like for our core financial systems in Portage County right now, and what is the proposed solution by the consultant that we're using to simplify the system. But just the numbers of bubbles that represent different spreadsheets and different databases and so on and so forth. Our current financial system in Portage County looks like this, and our proposed system will look like this. In a general sense, you can see that we are streamlining things, and that it will do a lot to reduce redundancies, perhaps, to streamline, to improve efficiencies. Here's our payroll, human resources and payroll system right now in Portage County government, and our proposed solution much more simple. So even from the television screen, you can notice that we've had a great need to get to this project, and it's no wonder we're talking about a project about a $1.4 million price tag for it as we estimate it today. I also want to touch on the introduction to this. This is the Baker Tilly report. This is the consultant that is helping us through the process that we have. I just want to read a little bit of it. It says that we have relied on a homegrown application developed on an AS400 platform to manage information related to administrative functions. As the county has used this platform for more than 15 years, a degree of specialization and customization has evolved, culminating in over 50 separate AS400 modules. These include modules for budget entry, charts of accounts maintenance, voucher processing, journal entry processing, cash receipting, and payroll management. Individual departments often have their own versions of these modules. For example, several departments have customized receipting and payroll modules. There's certainly nothing wrong with any of those things. It just means that this is an opportunity for us to look at it much more holistically, sort of from the center out, and then ensure that we've got everybody on the same page. We've reduced redundancies that aren't necessary in certain areas, that we've improved internal controls, and that we have the kind of tracking and the kind of technology that we need to be able to help us make better decisions based on data in our future in county government here. So that's a summary of this really big project. I'm really excited about where we are as we bring the needs assessment forward. We work through committees on that, and we continue to define the 2,000 to 5,000 functionalities that we're going to need for a vendor to help us address as we move our system forward and chart the path for our new technology for a system that will serve us for the next 10 to 15 years. So thank you, everybody, on that. Now, to my awesome guest, Janet Zander. Janet, it's really interesting. You used to be my boss, and now I'm yours for just a little while in our background. But welcome, welcome. I'm so happy that you're here.
Thank you.
You have one of the most incredible jobs in the county, I think, to be director of our Aging and Disability Resource Center. The ADRC, as folks are going to hear us use that acronym, I'm sure, during our conversation, and serving our population that continues to age in its demographic every day is a really big deal.
Absolutely. Absolutely.
And you have your anniversary coming up in October, 20 years.
20 fast years with the county.
So talk a little bit about what you do and, you know, about the ADRC in general, maybe some things that you're proud of before we get into the specifics of programs.
The department has changed a lot in those 20 years. We've seen tremendous growth in the areas of programs that have been tried and true, tested around the country so that we know that we're using our resources very effectively and efficiently. Transportation services continue in great demand across the country, across the county. Our caregiver services have seen a tremendous increase, and I think it has a lot to do with the aging demographic that you spoke of. We have nearly about 18% of our county right now is over the age of 60, and that number will continue to grow till about 1 in 5 of us will be an older adult. So it's a number that we've been anticipating for a long time. It's a number that we're gearing up for with programs and services, and what I think is so unique about our programs and services is that they are not only for older adults and adults with disabilities and their caregivers, but they're also delivered by older adults, adults with disabilities, and their families and caregivers. And so volunteerism plays such a key role in what our department does.
Right. I was just actually this week over helping to recognize our RSVP volunteers that just have so much to offer, and they give so many hours to make it possible that we can do all we do through the ADRC as well as other community organizations. I guess one of the important things kind of tracking on that is some of the volunteers present where we had that event this week had mentioned that they didn't even think that it was possible to have an Aging and Disability Resource Center if we did not have the support of volunteers, that they really felt like it would close if they didn't do all that they have to do.
They're absolutely
I think you hit the
correct.
nail on the head.
They're absolutely correct. Every year we have between 600 and 700 volunteers. The majority of those come to us from RSVP. The university is also a great source of volunteers for us. They provide the equivalent of between 15 and 16 full-time employees in terms of the service that they provide. We could simply not do what we do without them.
Now, when we use the words caregiver during this conversation, I really want the listeners to understand who we're talking about, what we're talking about. So can you just talk around that a little bit, as I think we take for granted that we use inside language sometimes, or that somebody might think, well, I know what a caregiver is. But really, what are we talking about when we talk about caregiver services?
Sure, and actually many of us don't recognize that we're involved in caregiving. A caregiver can be anybody who is a family member, a friend, a neighbor, who's providing any kind of assistance, whether it's somebody who lives nearby or long distance, who's helping pay bills, get groceries, take people to medical appointments. Those are the people we're calling those informal caregivers who actually provide the bulk of service to an individual. About 75 to 80% of the care people receive comes from what we would call those informal supports. In our department, we know that if we're truly going to help people stay living in the community, we need to support the work that those individuals do. And we do that by providing respite. So we have funds available to help provide respite for them, meaning giving them a break, bringing somebody in to offer them an opportunity to get away. We have adult day center where people can come to us and we can provide some care during the daytime hours so that people can have an opportunity to do some other work that they might need to get done. We have a tremendous amount of resources in the department, information about options available for care, about diseases, about how people could better take care of themselves, and understanding how important keeping that balance is. We have support groups. Last night I had the wonderful opportunity of being able to meet with some caregivers in our community to have them learn from each other. Thinking that we're all alone in the job that we do, it's really wonderful to hear that there's many people across our county who are also in that role of providing care and have been down that road and have some wonderful tips to share with each other. So just the opportunity to bring people together in a support group is a tremendous resource that we can provide.
And there are so many different needs. So what are some of the major issues that you would identify as those facing our older adults in Portage County?
Poverty. The rate of poverty among older adults is growing, certainly across the nation, but also here in our county, particularly among older women. Our poverty rate is about 8%, but 11% of women are living in poverty. So recognizing that women are often the head of household in an older adult family, have been widowed, perhaps never married, had incomes lower perhaps than the male counterparts. So dealing with some poverty issues. Falls. 1 in 3 older adults in our state is falling every year. So looking at ways that we can prevent the kinds of disabling conditions that result from falls, and giving people some opportunities to learn how to take better care of themselves and do some things to prevent those tragic events from occurring in the first place. 1 in 3 older adults who dies each year has some form of Alzheimer's or dementia. And so helping people recognize what steps might they want to take in advance in preparation for, we have an early memory loss class. How do we mentally take care of ourselves to keep ourselves as fit as possible? And then how do we support caregivers, work environments, et cetera, to support those who may be challenged with some of these diseases?
So when many people think about these kinds of issues, and we mentioned at the beginning that we have so many volunteers involved, you know, how are we helping ourselves? How are older adults helping older adults?
One of the best ways that older adults are helping older adults is by becoming a lay leader for some of our classes. We have opportunities to send folks to training or to provide in-house training so that they can be peer mentors, they can be instructors for classes, they can facilitate some of these evidence-based classes that I was referring to. They are often ambassadors. If they've taken a class, they can tell other people about the class. We can do all of the advertising in the world, and none of it is as effective as hearing from people who've actually participated and benefited from the classes. So that's a wonderful way. They're also advocates for the programs that we offer, helping get additional support for them. They're serving on advisory councils and board members and coalition members to help us raise public awareness about some of the issues, to help guide the process and how we deliver it, to help us know when we hit the mark and when we need to make some adjustments. So we want to make sure that we're not delivering these services in a vacuum, but really making sure that we're getting that feedback from the people we're trying to reach.
That's one thing I think the ADRC and you are really, really strong in, and that is that there are all of these methods that you use to gather the input and use that input from the users and the beneficiaries of the program to drive that program forward to become even better. You know, and I liken it to Girl Scouts, actually. It's like, I'm a lifelong Girl Scout, so I liken it to that because it's like, it's a girl-driven program, it's a girl-driven organization. Well, it's really quite similar. It's an older adult, an adult with disabilities-driven organization that you direct.
Absolutely, and it certainly needs to be that way, and we want to make sure that it doesn't just happen once every 3 years when we're putting together our service plan, but on an ongoing basis so that we stay on track.
Now, what are some new initiatives? You help me with a few key questions here, as everybody does. What are some new initiatives that the ADRC has for people who are aging or are having a disability at this point in their life?
Well, we have just hired our first ever prevention and health promotion coordinator. So one of the biggest opportunities that we will have now is to take some of the wonderful programs that we've been able to offer out of just Lincoln Center and bring them out to the rural parts of our community. And using these lay leaders that we talked about, these wonderful volunteers to help instruct, take it out to the Amherst, the Rochelle, the Junction cities, all of the communities that might have a desire to have some of these programs. So this health promotion person is going to be just terrific for our agency in getting these programs out further. We also are gearing up for a big Falls Prevention Day in September, on first day of fall, when they have National Falls Prevention Day. We're doing a big public awareness piece around that. It's called One Step at a Time, is the National Falls Prevention theme, preventing falls one step at a time, and so we hope to do a big campaign around that. We have been working diligently with the City of Stevens Point on a collaborative transportation initiative between Portage County and the City of Stevens Point to improve transportation services, recognizing that is the #1 thing that we hear from the citizens of the county, and that they would like to see more of. We've also done a great deal of expansion in the area of dementia services, again, knowing that that's a growing area of need. We have a grant to have a dementia care specialist. We have 2 new programs, one for caregivers and one for people with mild to moderate dementia that we're able to offer.
I have to say that you have the most creative designs to fit all the funding pieces together and all of the unique roles that staff need to play in order to make it work. So I congratulate you. You have to be the most innovative in all of that of anybody that I know working in county government right now. Now, one of the things about the ADRC that many people already know is that we have an excellent one. We already know that. But it's also excellent, not just from the eyes of our people in the local community, but from our state. They look to you, they look to our Portage County Aging and Disability Resource Center as one of the best in the entire state. And you have been honored recently with a fellowship that relates to women's policy, Wisconsin Women's Policy Institute. I wonder in the next minute or so if you can tell us a little bit about that and how you're helping to shape the policy for women in our state.
They are really helping us to gain additional skills so that we can effectively advocate for women's issues, but as well as the issues of older adults in our community, and bring back those skills to our community to work with older adults to shape policy, both at the local level and at the state and national level, so that we can improve the lives of older adults. And we're doing everything from looking at the budget to looking at current state statutes, to I'm working on a project that has to do with possibly requesting a legislative council study to deal with emergency home repairs for seniors in our community. So it's been a wonderful opportunity to work very closely with all branches of government and find out how we can, in fact, influence that process in a way that would make the lives of older adults better.
And the thing that I really love to let people know is that if they want to have a connection to shaping the future of policy in Wisconsin for women, older adults who are women in particular, that they should contact you, contact the Aging and Disability Resource Center, or my office will get you connected with Janet to be able to weigh in and make that happen. Janet, I have to tell you and all of your staff how deeply I appreciate what you do. And on behalf of the people of this county, I can't imagine what our world would be like without you. So
we're honored
thank you
to serve.
for the mission.
Thank you.
Next month for our show, my guest will be Scott Rifleman. He's our coroner in Portage County, and we're going to talk about why he is a very busy man these days and some things that I think all of us will be able to do about that as we want to continue to shape the healthiest community we know how to here in central Wisconsin. Thanks everybody for joining us, and thank you, Janet.
You're welcome. Thank you.